Good afternoon. I'm Judy Hopkins, the Chair of the Human Services Committee, and I call this meeting to order. First order of business is to take a roll call. Ms. Megan?
Mrs. Hopkins,
Here.
Mrs. Burdick,
Here.
Mr. Barnes,
Present.
Mr. Decker,
Here.
Mr. Havey,
Here.
Mrs. Root, Mr. Stockin,
Here.
Mr. Crandall. 6 members present, 2 absent.
Thank you very much. The next order of business is to approve the minutes of June 2nd, 2021. Do I have a motion on that? Mr. Havey, second by Mr. Decker. Any questions, discussion, changes? All those in favor, please say aye.
Aye.
Any opposed? That passed. Okay, well, let's do the minutes for June 28th, 2021. Need a motion to start that. Mr. Decker, second, Mr. Stockin. Any questions, discussion? If not, all those in favor, please say aye.
Aye.
Any opposed? That motion is passed. Thank you. Okay, our first report for this month is Tyler Shaw, our Public Health Director. He is with us today. Thank you for coming, Tyler. We'll give you a minute to get to the podium.
Good afternoon.
Okay.
Have to put this in too. All right, I think I'm set.
Okay. Do you want to share any highlights from your report? And of course, we'll be looking for a COVID update.
Absolutely. Monthly report updates. Lead cases continue to increase with our blood lead level decrease. So we're moved from May 2020. We had 69 tests reviewed. This same time this year, we're up to 82. We went from 18 cases managed to 45. So we are seeing a dramatic increase in our lead poisoning prevention program. That mainly it's due to the decrease in go ahead.
Tyler, what do you attribute that increase to?
Mainly that increase is due to the decrease in the threshold for the blood lead levels. The state recently decreased that from 10 to 5. So we saw a lot of kids being captured in that. Yep.
And also, wouldn't the fact that people were isolated a lot over the last year and a half also start to bring some of that out?
Unintended consequence of the pandemic. Yep. People being more indoors, children being out of school, being home. Yep. COVID update. So we do have our COVID vaccines on there, 537. We are still offering COVID-19 vaccines. We have a Pfizer clinic on Friday. Our plan is to offer some vaccines at the fairgrounds as well once the fair is going on. Our vaccine rates are still pretty low. Still a little worried about that. If we do see a surge, our community is being protected. So we are still encouraging people to get their vaccines. We do have all 3 vaccines available. Likely we'll be offering the J&J vaccine at the fairgrounds because it's a 1 dose. Don't need to follow up with a second appointment. But we do have Moderna and Pfizer available as well.
Will you be asking people to make appointments for that at the fair, Tyler, or is it a walk-in?
If they can make appointments, that would be helpful, but there's no need.
Okay, thank you. And do we have, I'm sorry, Mr. Fenton has a question.
Is there any way you can tell how many vaccines had it in the county? I mean, I know the ones.
Dwight, we need your mic.
The proportion of people that have actually had this and then recovered from it, even without knowing they had it sometime. Is there any way of finding out what percentage that really might not need to be vaccinated?
They'd have to get an antibody test, and that would tell them if they had a previous infection or their immune system mounted a response to having COVID-19. They'd have to go get that testing.
But as of right now, nobody's really looking at that part of it.
No.
Okay, thank you.
And just to follow up with that then, isn't it the case that the resistance to the disease from a person who's had it doesn't last as long as the vaccine? Is that the case?
That there are studies out there that do indicate that, and they're also looking at everyone's different. So everyone's immune system is different, and what level actually offers you that constant level of protection to COVID. So.
Okay. Thank you. Any other questions about Tyler's report or COVID-19? That was short, Tyler. Yeah, a year ago, we were talking for an hour about that.
Yes,
Okay.
yes.
Okay, go ahead.
All right, next on the agenda, we have a request to fill a public health technician, and this is due to a recent promotion in our office. So I'm looking for approval to fill that public health technician position.
Okay, we're looking for a motion to start that. Mr. Havey, second, Mr. Stockin. Okay, as you said, this is due to a promotion.
Yep.
The other thing we were looking at too, seems like I saw it somewhere, there was just the number of cases and the need was emphasized within your report at some point for that. So any questions about this? Okay. If not, all those in favor, please say aye.
Aye.
Any opposed? That motion is passed. Thank you, Tyler. Next.
Next up is a request to accept and appropriate our ELC school reopening grant funds. We were awarded over $1.4 million for this grant, so we are looking to appropriate that. We did just submit our grant for approval, but we wanted to make sure we got this in there so we're able to spend out some of this money. Primarily, what you're looking at the appropriations, we'll be bringing some new temporary staff positions forward at a later committee meeting. We're looking at computers, rapid testing machines, testing kits for the rapid testing machines, and also an option for the schools to do mobile units for testing at the schools. This money has to be used to keep the schools open. So we've worked with all of our school districts on what their needs would be come the fall. So we've kind of got a mixed bag of some schools want their own machines to do their own testing, and some schools kind of want the one-stop shop where another agency would come in and do the testing for them.
So do you have any idea of what those types of temporary positions are going to be that you said you're going to be bringing forward? What types of,
Preliminarily, we're looking at probably a program coordinator to kind of oversee all the school districts and their needs and the testing supplies and the ordering, and then possibly a typist on top of that to help with some grant clerical work.
thank you. Any other questions? Mr. Stockin? Yes, we do. Thank you. I'll move by Mr. Stockin, second by Mrs. Burdick. Questions, Mrs. Burdick?
Is this for 1 year or will it be for forever or?
Good question. I get my two grant, there's another grant out there, I get those two confused, so I want to make sure I get you the correct date on here. This one is through, I believe, July 2022. So we have a little less than a year.
So after that, the positions will be eliminated, or do you have to continue to do this, have this program?
When we bring the positions, they'll be temporary until this grant expires, so it'll be that until July 2022, unless it gets extended. Yep.
Okay, thank you. Okay, if there are no other questions, all those in favor, please say aye.
Aye.
Any opposed? That motion is passed. Thank you, Tyler. We'll move on to the second grant.
Next is I'm requesting to accept and appropriate ELC COVID-19 grant funds. We were awarded an additional $327,000 from the federal government, and I have my appropriations delineated out there. This program is to support new personnel to enhance case investigations, contact tracing, vaccination activities across communities, schools, childcare programs. So we'll likely be looking for possibly 2 temporary staff there as well, and might be nurses to help us with the vaccine effort. That's still preliminary. I'll bring that through committee, of course. Looking at computers, office supplies. You'll see in the general supply line, there's $45,000 in that line. That is for school supplies, such as hand sanitizer, wipes for the schools, and general PPE that they'll need to conduct their testing and to basically protect their children throughout the school year. So quite a bit of money in there to help offset the cost for the schools and get them some supplies.
Okay. Thank you. We'll need a motion to start that. Mr. Havey, second, Mr. Stockin. Questions? Okay. All those in favor, please say aye.
Aye.
Any opposed? That motion is passed. Thank you. Sounds like some good preparations coming up, so we won't be taken off guard. That's
Lots of
good.
planning.
Yeah.
Judy,
Yes,
Can I
Mrs. Burdick.
this is money separate from the American Rescue Plan, right?
Correct.
And from what I'm reading, this is state money, is that correct? Right.
Federal money
It is federal coming through
being
there?
passed through the state.
Okay. Okay. Okay, next on the agenda is the request to transfer funds.
Apparently I didn't print that one off, but I do have a request to transfer funds. And I believe that's the WIC program, and they're looking to transfer funds to cover additional expenses this year because they aren't getting an increase in their grant budget for this year. It's an extension. So they're looking to move monies in order to cover some other expenses.
Okay, and so this is a total of $8,147 that would be moved from one account to another. Need a motion for that, please? Mr. Decker, second by Mrs. Burdick. Questions? Okay, all those in favor, please say aye.
Aye.
Any opposed? That motion is passed. Thank you. And next,
Next, I'm looking for approval for a renewal contract, renewal of a maintenance agreement between our WIC program and KOS Incorporated. This has been reviewed by our IT department and suggested to move forward with that.
okay, and this is off-site, this is at the WIC
Yes, correct.
location. So we'll need a motion to start that. Mr. Stockin, second by Mr. Decker. Any questions? Pretty straightforward. All those in favor, please say aye.
Aye.
Any opposed? That motion is passed. Thank you.
Next up, I'm looking for renewal, approval for renewal of a maintenance agreement between our WIC program and Grant and Brinks, which is their telephone service. And both of these grants, I'll make a clarification, are for next year. These agreements are for next year. They do want to prepay these in their budget this year if possible.
So will this come out of this year's budget then? You have to do that, and then you have money in the budget to do that?
That's correct.
Okay. Okay. So we'll need a motion to start that. This is with WIC and Grants and Brink Incorporated, in case anybody's lost in the long agenda. Mr. Havey, thank you. And Mr. Stockin, thank you. Questions? Okay, all those in favor, please say aye. Aye. Any opposed? Okay, that motion is passed. Thank you. We have the renewal of the WIC program annual contracts.
So these contracts are annual contracts for our WIC program, which are our satellite sites. So with in-person activities starting to ramp up, WIC is required to go out off-site. We have various contracts with churches and fire halls in order to conduct WIC clinics out in the communities.
Okay, so these are different from the Brooks Hose, New Hudson Fire.
These are different.
Those are, okay. So would you just share with us who these are with?
Sure. Alfred Seventh-day Baptist Church, Angelica United Methodist Church, Belfast United Methodist Church, Bolivar Fire Hall, Canasarega Fire Hall, Cuba First Baptist Church, Fillmore Wesleyan Church, and Friendship United Methodist Church.
Thank you, that's helpful. Okay, we need a motion on that, please. Mr. Stockin, second by Mrs. Burdick. Questions? All those in favor, please say aye.
Aye.
Any opposed? That motion's passed. Okay, and now we're going to do the ratification of the health director's signature. I'll let you say it. You can say it easier than I can.
So I'm looking for approval of my signature on agreements with William P. Brooks Hose Company, and this was for our community vaccination, COVID-19 vaccination clinics. So I'm looking for that approval first.
Okay. Motion on that one, Mr. Decker, second, Mr. Stockin. Any questions?
I just want to make a comment on these three. We're ratifying Mr. Shaw's signature because there was not time to come to committee. We needed to get these vaccination clinics scheduled, and I did ask him to go ahead and sign those lease agreements and come in and notify you later.
Thank you
Thank
very
you.
much. Thank you. And so we will have three of these altogether. So all those in favor of the William P. Brooks hose contract ratification signature, please say aye.
Aye.
Any opposed? That is passed. Thank you. And the next one is the same thing with the New Hudson Fire Department. Need a motion on that. Mr. Decker, second, Mr. Hamey. Okay. Any questions? All those in favor, please say aye.
Aye.
Any opposed? That's passed also. And finally, we're ratifying Tyler's signature on the Independence Fire District contract as well. Need a motion? Mr. Havey, second, Mr. Decker. Okay, and questions? All those in favor, please say aye.
Aye.
Any opposed? That motion's passed. Thank you. Okay. Anything else you'd like to share with us today, Tyler?
I did. I just had a little, an extra COVID update, if you will. No news so far for the younger 6-month and over population for a vaccine approval yet. They're thinking possibly this fall, so that's on the horizon. The 12 to 15-year-old approval for Moderna. Right now, 12 to 15-year-olds are approved to receive the Pfizer vaccine. Likely Moderna will be approved for that age group as well, so we'll have 2 vaccines in market for our 12 to 15-year-olds. That's likely to come in the next few weeks. So just wanted to put that out there as well.
Thank you very much. Thanks for all your hard work.
Thank you.
Okay. Thank you. Next on our agenda is Anita Madison, Office of the Aging Director. Anita's with us today. We'll give her a minute to get to the mic. Thanks for being here, Anita.
Thank you.
You'd like to share some highlights from your report?
Yes, I would. So for the month of May, which is the monthly report you have in front of you, a couple of highlights that I'd like to bring to your attention is the PC1 and PC2 service line. You'll see a decrease from the previous month. That actually is due to the aid shortage that we have, which we are addressing with the part-time labor positions that we are creating. So the number of case managed clients that we have open did not decrease, even though those numbers of hours of service provided did. And it is a reflection of the aid shortage that we have. On the second page, there are 2 new events that we have incorporated into our daily procedures. So we are now doing online book clubs as support groups in addition to our regular support groups. We started this during COVID and the response was amazing. So we are going to continue providing this service in addition to our 2 monthly support groups, and they will continue on usually twice a month.
And if someone listening at home wanted to be a part of that, how would they just call the Office of the Aging phone number? to be in?
Yes, they
Okay.
would call our office. Lynn Oyer is the one who's in charge of those, and they can do the registration right through Lynn. There is some information that we would have to get from them, and then we provide the materials to them, so they don't have to purchase a book themselves. We provide that to them.
Okay, great. Sounds like a great idea. Good, okay. Anything
it.
else?
Nope.
Okay. All right, then we'll move ahead to the request to reappropriate CARES Act funding.
Okay, so we are looking to reappropriate a total of $43,040 from the 2020 budget to the 2021 budget. Our total allocation for this, for the CARES funding, was $118,297, of which we have spent $75,257. So looking to reappropriate that into this year's budget. We will be using this to cover services for transportation, Meals on Wheels, and other ancillary services for older adults.
Okay, we'll need a motion to start that. Mr. Decker, second Mr. Stockin. Questions? Okay, so they don't have any limits on how you can use that in the second reappropriation?
As of right now, no, because we are still underneath a federal MDD, so we are allowed to spend that money wherever we need to at this point.
Okay, thank you. Okay. All those in favor, please say aye.
Aye.
Any opposed? Okay, that motion is passed. Thank you. Next, Anita.
The second thing on our agenda is a request for a resolution to accept a donation of $756 from the Allegheny County Student Government. This is a donation that came from the walk-a-thon and the t-shirt sales that happened in May. We will be using it for travel expenses for the home delivered meals program.
Okay, and we certainly thank them for their efforts to raise that money.
Absolutely. It was a wonderful event. Although I couldn't be here for the event, I heard wonderful things about it.
That's great. Motion by Mr. Stockin to accept, second by Mr. Decker. That's great. Any questions? Okay, all those in favor, please say aye.
Aye.
Any opposed? That motion's passed. Thank you. And again, thank you to the student government, Allegheny County Student Government. Okay, and next?
Next on our agenda, we are asking for a resolution to accept $239,889 in federal funds under the Consolidated Appropriations Act as well as the American Rescue Plan. We are looking to increase COVID vaccine assistance, home care, home delivered meals, PERS, which are personal emergency response units in homes. There is a 10% county match for all 4 grants. It actually is supposed to be a 4 funding streams that are requiring it. So a total of $21,164, and that we have on here from the contingency fund.
Okay. We need a motion to start that, please. Mr. Habe, second Mrs. Burdick. Questions about this? Okay, all those in favor, please say aye.
Aye.
Any opposed? Has passed. Thank you. And last, the approval of the contract.
Yes, the last thing on our agenda is a request permission to enter into a contract with Accessible Solutions for the Serve Tracker program. It's a software program that will allow us to use it during our home delivered meals routes for route optimization as well as our congregate sites. We currently have a system that is from 2000, which is very old when you come to computers and software. So we are looking to upgrade that to make it more efficient. The initial cost is $8,565. That actually is going to be covered completely underneath one of our federal grants that we are receiving. And the ongoing monthly fee will be built into our budgets going forward.
Okay, thank you. We'll need a motion to start. Mr. Stockin, second Mr. Decker. Any questions? I have one.
Okay.
When you talk about route optimization, can you explain that a little bit? Are you looking to save mileage, save time between places? How is that to be optimized?
Both, actually. We are looking at using the software to be able to plot our routes more effectively, to save on time, which will save on our temperatures for our nutrition standards. It also will allow us to use it during our volunteer routes, which we do pay mileage for. So our volunteer routes will hopefully reduce some of the mileage by plotting the routes. It also will give us a GPS option, so if we have to add someone last minute, we can actually send that directly to the cell phone of the driver, and they can add it right into a route while they're out on the road.
Okay, great. And I presume that we'll be hearing figures on how that has been optimized in the future.
Yes.
Great, okay. Okay, we're, I think, ready to vote on that then. All those in favor, please say aye.
Aye.
Any opposed? That is passed. Thank you, Anita. Is there anything else you'd like to share?
No, thank you very much.
Okay, thank you for coming today. Appreciate it. Okay, and our next department that we're going to hear from is the Department of Social Services. Commissioner Edna Case is with us today. We'll give her a minute to get to the mic. Welcome,
Good
Edna.
afternoon.
Hi. Okay, we'll let you share from your monthly report.
On the monthly report, I guess a highlight would be that we are able to start moving forward with our job track services in the employment unit. We're really excited about that because it's been a long time. So, and just to remind you that we place employable persons that receive safety net and temporary assistance benefits to assist them with developing skills to become employable. We don't take anybody else's jobs away. We just try to help to place them so they can become employable and learn skills.
Okay.
So we're excited about that. Although not on the report, I just wanted to share some exciting news that the RTA GAP money is now totally reimbursed to the county, and there is no outstanding bill, and we have no longer any responsibility to the RTA GAP. So that's a good news.
That is very good news. Thank you for sharing that.
Yes, very
And-
excited about that.
Thank you to our treasurer for keeping track of all of that as it goes in and out. Thank you. Good news.
And we made we ended up making a good relationship with a gentleman in the state that kept us up to date. That was very helpful. So
Good,
hopefully we can use that relationship going forward.
good.
That's really my highlights. Any questions?
Okay. Any questions about the report? Okay, we'll move along to the request to fill the account clerk typist and all subsequent positions from there.
So we'd like to ask for a filling of the account clerk typist position and any backfills, also including opening to any public if necessary, opening to the public. We have not filled this position in a while. And we are finding that we are really needing the help. We're getting behind in a couple of areas in our department. So I think that we've gone as long as we can go filling this position, and I'm hopeful that you'll consider filling this for us. I know that we didn't fill it through COVID, and we've hung on, so I'm hoping that, and we're needing a little help, so I'm hoping that you'll give it consideration. The annual salary of the position is $31,000 to $37,000. Cost of benefits are $12,000 to $14,000. And the position is the funding for the position is offset by TANF collections, and 0% state and 66% federal. So I'm hoping that you'll give that some consideration. And the amount is in the current year budget for the position.
Okay, that answers all my questions. I need a motion to start. Mr. Havey, second, Mrs. Burdick. Other questions? Okay, all those in favor, please say aye.
Aye.
Any opposed? That motion is passed. Thank you. Okay,
So our next position is a caseworker position, resulting in any resulting backfills, including going to the public if necessary. This is due to a retirement. Jim Mulligan has retired. He was working in adult services. He will be greatly missed, especially by me. He's one of the last ones that was here when I started. So I guess that makes me the oldest in that area now. Although I know I look young. Anyways, the annual salary of the position is $41,000 to $51,000. Cost of the benefits for the position is $16,000 to $20,000. The source of the funding for the position is 35.57% county, 21.89% state, 42.54% federal. And the amount is in the current year's budget for the position.
okay. And we see you have all the necessary signatures as well. So we need a motion to start that. Mr. Havey, second by Mr. Decker. Questions from the floor? Okay, all those in favor, please say aye.
Aye.
Any opposed? That motion is passed. Thank you.
Mr. Mulligan's final email said that Elvis has left the building. Peace. So next we are requesting a resolution to amend the 21 contract with Dr. Zuckerman from Rehabilitation Today Services. We would like to increase the hour of services from 4 to 7 hours per week. And we'd like to increase that from 20,000 to 35,000. 35,916 for sexual abuse counseling. We'd like to also move that into the CAC budget so that will then result in $0 increase to local share, and we'll take any payment that we have to him at this point and put it into the CAC payments, so that will eliminate local share on his contract.
Okay, we need a motion to start this. Mr. Stockin, second, Mr. Decker. I assume that you have worked with our county treasurer to work all of these transfers out?
No?
No? Okay,
Well, that's, my understanding was that it was done, so I'll
Oh.
certainly take care of that.
okay. All right,
All right, I'll make sure it's taken care of, Terry.
okay.
Accept my apologies.
Okay, all those, any questions? Yes, Mr. Decker?
And what, why the big increase? What,
To increase his hours, because when we were working with our contract with him, that's what our contract was. If we use the child advocacy money, then we can increase those hours, because we're not putting any money into that. The CAC will pay for that, and there's plenty of room in that budget.
And you're finding more young people need the
Yes.
counseling than
Yes.
before?
And the other piece too is that he has, I don't know, I don't want to say moved into semi-retirement, but he's not doing medical billing in his office anymore. He is only working on contracts, which has freed up some of his time as well. He's been extremely supportive of the Child Advocacy Center. He does go over and he works with our therapist to see how she's doing, if she needs any support. He doesn't charge us to do any of that work. So he's been nothing but a great benefit to the Child Advocacy Center since we took it over.
Okay. Any other questions? Okay, all those in favor, please say aye.
I,
Any opposed? That motion is passed. Thank you. And now we're looking at a contract with the Employment and Training Center, For the-
Yes.
SYEP program.
Yep, summer youth employment. It's $185,498. Zero increase to local share, and we look forward to this every year.
Okay. How many youth do you employ through this?
I don't know. I can't tell you the answer. I can find that out for you. Rita's really the expert. We're just really kind of a pass-through, I feel like.
I see, thank you. Need a motion to start. Mr. Havey, second, Mr. Stockin. Questions? All those in favor, please say aye.
I,
Any opposed? That motion is passed. Thank you. And the next one is with Olean General for CAC laboratory testing.
Yes, we are requesting a contract to complement our medical services at the Child Advocacy Center with Olean General to do our lab testing. And this is, it's billed as approved by the Medicaid rate, and it's zero increase to local share. It comes out of the Child Advocacy budget as well.
Okay, we're looking for a motion. Mr. Havey, second, Mr. Stockin. Any questions for Edna? Yes, Mr. Decker.
and what's the rate on this then? Or how does that determine? I don't see anything on here.
So the state Medicaid, I can't tell you the rate. The rate is based on whatever the test is. So you might go in and you might receive Medicaid, you might get a blood draw for a particular test. That test might cost X dollars, X amount of dollars, but then the Medicaid rate will only pay this amount of that money toward that. So it depends on what it is. So it depends on what the test is for, what the Medicaid rate
Right.
will be.
Okay. It's like any other, if you've got Medicaid or some other insurance, that one takes precedent over the other.
Well, you wouldn't have Medicaid with another insurance, but you would have, your insurance probably costs more,
Right.
right?
That's what I meant to say.
Yes, yes.
Mr. Healy?
Thank you, Madam Commissioner. Is this just for those cases over in Cattaraugus County, or is that for
Both.
both Allegheny and
Yes.
Cattaraugus County cases? Okay, thank you.
Okay, any other questions? Okay, all those in favor, please say aye.
Aye.
Any opposed? That motion is passed. Thank you. And the last request?
The last request is just accept and appropriate federal funds for grants to Adult Protective Services to respond to COVID-19 from April to May, April 21 to May of 22, in the amount of $15,700. Actually, it would be a savings of $15,700 for the local share. And then there's a budget there of what we plan to spend the money on that I think we included in your packets.
Okay. Need a motion to start that? Mr. Stockin, second Mrs. Burdick. Questions? Okay, if not, all those in favor, please say aye.
Aye.
Any opposed? That motion is passed. Thank you, Edna. Anything else you need to share with us today?
Not today.
Not today.
Thanks.
Okay, thank you for coming. Okay, is there any old business today? Any new business? Anything for the good of the order? Mr. Stockin?
I'd just like to express my appreciation to the chair for the expert handling of this extensive agenda.
Thank you. Thank
Goes
you.
without saying, doesn't it?
Thank you. And with that, do we have a motion for adjournment?
Madam Chair, it seems that there's no more business to come before this last committee of the day. I recommend that we adjourn.
Is there any objection to that? No, we are adjourned. Okay. What's that? Nobody seconded it. Oh my goodness, Mrs. Burdick seconded it. We're not too anxious, are we? Thank
in
you all
favor
very much.
say
Thank you.